Dr. Mead is of course very kind and very understanding. He's very explanatory, very supportive. He calls every now and again just to see how things are going. It's just something you don't always see in a physician because of time constraints, but he makes time to do those things. It's very special.
Sherry Welch is talking about Dr. Ricardo Mead, a board-certified plastic surgeon who also happens to be bilingual. Following his residency at Duke, Dr. Mead received additional training by completing a fellowship subspecializing in cosmetic surgery procedures at the UT Southwestern Plastic Surgery Program and the Dallas Plastic Surgery Institute.
As a cutting-edge plastic surgeon today, we can offer all sorts of a spectrum of options in plastic surgery. And whether it just starts with a filler and Botox or it goes all the way up to rejuvenating procedures. And I think that each procedure needs to be tailored to suit each patient's face. I did Sherry's face and her neck, and that was to improve both the jawline, her neck, and her cheeks. And the operation stopped at the height of her cheeks, so we didn't do anything to her lower lids, upper lids, or brow. And that's something that we're talking about doing in the future. She's a very pleased patient. Carrie, how are you?
How are you?
Good to see you.
Carrie Pemberton is also one of Dr. Mead's satisfied patients. She wasn't interested in coming back every few years for a touch-up. She wanted it done once with a lasting effect.
Oh gosh, I just love Dr. Mead. I trust him. If he told me that I needed anything else done, I would do it. And he wouldn't do it as overkill. He would do it if I truly needed it done, and I would feel comfortable with it.
Carrie actually came in for a freshening up. She said, what do I need? I haven't done anything. How can you make me look freshened up? And what we focused on with Carrie was repositioning of her eyebrows and her upper and lower eyelids. And Carrie had shadowing around her lower lids in particular. She just did remarkable. She had a really great improvement in her periorbital area. For Carrie's jawline, I did a resuspension of her neck. And so in resuspending the neck, all we do is through all concealed incisions that go around the ear and in the hairline, we expose the neck muscles and tighten from the inside. Same thing with the facial, cheek and jowl area. All of that is tightened up underneath the skin, and then the skin is placed over it softly. So if everything is tight underneath the skin and the skin is placed softly, everything is held in from a deeper anchor, and the skin just lays over it gently so that there's no stretched appearance, which is what nobody wants.
I've had customers that thought I went on vacation and has had a great vacation because that I looked refreshed. And I said, I had a whole facelift. And they went, no.
I feel like he gave me 15 years back of my life. It's been a great experience, and he's going to be a lifetime friend for that.
I've loved it. There's nothing I would change, not a thing.